Most men over 50 spend months, sometimes years, chasing the wrong answer. They go in for blood work. They wait for results. And when everything comes back normal, they sit in that car in the parking lot and feel something cold settle in their chest. Because if it's not the hormones, what the hell is it? Here's what nobody is telling you. There is a region in your body, barely the size of a coin, that, when you apply the right pressure for just 60 seconds, can begin unlocking something you thought you had permanently lost. And right now, most men have never even heard this region exists. I'm Dr. Natalia Parker, and I'm going to walk you through exactly what's happening. And more importantly, exactly what you can do about it today. But before I tell you where this point is, you need to understand something first, because if you skip this part, the technique won't work. And I mean that literally. The reason most men fail, even the ones who eventually find the right spot, is that they don't understand what's actually causing the problem. So they treat symptoms instead of the source, and they keep cycling through the same frustration over and over again. Let's start with the assumption almost every man makes. The first place your mind goes when things slow down, when the response isn't what it used to be, when the body just doesn't cooperate the way it did at 35. The first assumption is always testosterone. Makes sense, right? Testosterone drops with age. That's common knowledge, so you book an appointment, you get the labs done, and then you get the results back and the doctor says everything looks fine. Normal range, nothing flagged. And that exact moment, is where the real damage starts. Because now you don't have an answer. You have normal labs and an abnormal experience. And that gap between the two is where silent shame begins to build, where men stop talking about it, where they start believing it might be permanent. But here's what I need you to hear clearly. The issue is not your testosterone levels. The issue is not your age. The issue is not willpower or attraction or stress alone. The issue is that your body has developed an interference pattern. Think of it like this. Your body still has everything it needs to function. The desire is still there. The biology is still intact. The hormones are present. But there's a signal block happening somewhere between the source and the destination. Imagine you have a phone with a full battery. The phone works perfectly, but you're in a dead zone. No matter how many times you try to make a call, it won't go through. That's what's happening inside you right now. And the location of that dead zone is somewhere most doctors never mention during routine checkups. It's happening inside your pelvis, and it's been happening for a long time. Here's what I want you to think about. Every single day, most American men over 50 spend somewhere between 8 and 12 hours sitting, in the car during the commute, at the desk at work, on the couch in the evening, and every single hour you spend sitting, something silent is happening deep in the muscles of your pelvis. These muscles, layers of tissue and nerve you've probably never thought about in your life, they start to contract, slowly, without pain, without any obvious symptom or red flag. And over time, months, years, sometimes decades, they stop knowing how to release. They forget how to let go. They become a permanent knot. And that knot is sitting right on top of the nerves and blood vessels that are responsible for everything you need for a healthy, intimate life. And here's the terrifying part. This process didn't start last week. It's been building since you were in your late 30s, accumulating layer by layer, completely underneath your awareness. And every day that passes without reversing it, the block gets denser, the signals get weaker, the response gets slower, until one morning you wake up and realize things have changed. And you ask yourself the question that every man eventually asks himself, alone in the dark, afraid of the answer. Is this permanent? Is there no way back? The answer is no. This is not permanent. But to understand how to undo it, you first need to understand the cycle that is actively feeding itself inside your body right now. Because this isn't just about muscle tension, it's a multi-system loop, a combination of factors that each make the others worse, creating a compounding effect that accelerates on its own if you don't interrupt it. And I'm going to walk you through each piece of it, because when you see the full picture, everything clicks into place. After 50, a molecule called nitric oxide starts naturally declining in your system. This is the compound that acts like a key for your blood vessels. It's what tells the small arteries in your pelvic region to open up and let blood flow through. When nitric oxide levels drop, those arteries can't expand the way they should. Think of trying to inflate a balloon through a pinched straw. The air wants to get in, but the opening won't cooperate, and the result is never quite what you're aiming for. At the same time, and this is where it gets more serious, microscopic plaque begins depositing along the inner walls of those same vessels. Now, this isn't severe enough to be labeled a cardiovascular condition. Your doctor won't flag it on an EKG, but it's enough to meaningfully reduce the pressure and firmness of blood flow to the region that needs it most. You're not dealing with a disease, you're dealing with slow, quiet, cumulative obstruction. And while that's happening, the nerves responsible for transmitting arousal signals are slowing down. They haven't stopped, they're just taking longer to fire. And when they do fire, the signal that arrives is weaker, more scattered, more vulnerable to anything that's competing for your brain's attention. Stress, worry, distraction, any of it can intercept that signal before it completes its circuit. Now pile all of that on top of each other. Chronically tensed muscles compressing nerves and vessels from the outside, blood vessels that can't open properly, slower, weaker nerve signals, and then add the one factor that amplifies all of it exponentially, and that almost nobody talks about in plain terms: chronic stress. When your body is in stress mode, it activates what's called the sympathetic nervous system, fight or flight, survival first. And in survival mode, the last thing your body wants to prioritize is intimacy. It redirects blood flow to large muscle groups, to your heart and lungs. The pelvic region drops to the bottom of the list. And the cruel irony is that even when everything else is right, the moment is right, your partner is there, the environment is perfect, your body can't switch modes fast enough. It spent all day running on emergency settings, and it doesn't know how to turn that off on demand. So what's the solution? That's what I'm going to show you. And it starts in a place that traditional medicine almost never mentions during a routine office visit. Comment below and tell me what state you're watching from, because I see men from every corner of this country dealing with exactly this, feeling completely alone with it, and that needs to stop. So, where exactly is this point? Between the base of the scrotum and the back opening, there's a small area called the perineum. Most men have never heard of it. Some have seen the word and never thought twice about it. What they don't know is that this tiny patch of tissue is essentially the command center for male intimate function. And it has been completely ignored in men's health conversations for decades. Through that region passes a nerve called the pudendal nerve. This is the nerve that sends the signals telling your brain, everything is ready, everything is a go. Running alongside it are small arteries that deliver oxygenated blood directly to the base. And supporting all of it is a complex web of pelvic floor muscles that control how much blood enters and how long it stays. Now picture this: that nerve, those arteries, those muscles, all of them compressed, crowded, restricted for years, possibly decades. And nobody ever told you that you could release that compression, that you had that power, that it was that accessible. When you apply the right kind of pressure, controlled, intentional pressure, to this specific point, something immediate begins to shift. The muscles begin to release their grip, the vessels begin to open, the nerve begins to wake up. A lot of men describe feeling warmth spread through the pelvis. Others describe a sense of fullness, of weight, of pressure redistributing. It's not a sudden dramatic result. It's the body remembering how to do something it forgot. And that process, that remembering, is what we're trying to trigger. But here's the critical mistake that destroys results for about 90% of the men who try this. They find the general area, press hard for a few seconds, don't feel anything dramatic in the first 30 seconds, and quit. They treat it like a button you push and something instantly switches on. That's not what this is. And that misunderstanding is what keeps most men stuck. This technique works because you are not forcing anything. You are convincing your body to release something it has been holding onto for a very long time. That requires patience. It requires a specific approach. It requires your nervous system to cooperate. And your nervous system doesn't cooperate when you're impatient and tense and pressing too hard. Let me walk you through exactly how to do this correctly. Start by sitting in a firm chair. Not a soft couch, not a recliner, a firm, flat surface like a regular dining chair. This matters more than it sounds. If you're sinking into cushions, your pelvis is misaligned and you won't be able to access the point accurately. The chair needs to give your sit bones solid, even contact with the surface. Use 2 fingers or a small massage ball if you have one. I recommend starting with your fingers because you have direct, real-time feedback on the pressure you're applying. Locate the midpoint between the base of the scrotum and the posterior opening. Right in the center of that distance, you'll feel a slight depression, a small, natural space between the muscle groups. That's your target. You don't need to press deeply. You don't need to apply intense force. You'll notice this area is sensitive. That's normal. That sensitivity is years of accumulated tension that hasn't been touched or addressed. It's not pain, it's information. Your body telling you this area has been neglected for a long time. Now, here is the step that most people rush past, and it's the single most important part of this entire technique. As you apply slow, steady pressure, not pulsing, not jabbing, steady and gentle, you need to breathe. Diaphragmatic breathing, belly breathing. Put one hand on your stomach. When you inhale, your belly should rise. When you exhale, it falls. This type of breathing directly activates the parasympathetic nervous system, the rest and digest system, the system responsible for relaxation, for recovery, for arousal. If you're doing the pressure while breathing fast and shallow through your chest, it will not work. Your body is still reading that as a threat signal. It will keep the muscles locked. The key is that the breathing has to tell the nervous system it's safe to let go. Hold the pressure for 10 to 15 seconds. Breathe slowly. 3 seconds in, 3 seconds out. Then begin small, slow circular movements, like you're melting a knot of wax with a warm thumb. Not a quick massage. A slow, deliberate, almost meditative circular motion. Continue this for the full 60 seconds. No rushing, no forcing, just steady presence and intentional breathing. What happens physiologically during that minute is remarkable. The pelvic floor begins to soften. The vessels begin to dilate. Fresh, oxygenated blood starts moving into tissue that has been oxygen deprived for years. The nerve becomes more responsive. Many men feel warmth spreading through the lower pelvis within a few minutes. Some feel tingling, the kind you feel in a foot that's been asleep and is finally waking up. Some feel a sense of weight or fullness that wasn't there before. All of those sensations are positive signs. They're evidence that the circulation is returning to normal, that the signals are starting to transmit clearly again. One critical note: if you feel sharp pain, stop. This should not be painful. It may be uncomfortable, especially in the first few days as you're working on tissue that's been restricted for years. But sharp or intense pain means you're pressing too hard or in the wrong location. Back off. Adjust. Try again with less pressure. The goal is to work with the tissue, not fight it. Here's something that surprises a lot of men. In the first 2 or 3 days, sensitivity in the area may actually increase slightly. Don't panic. This doesn't mean things are getting worse. It means you're finally paying attention to something that's been ignored for decades. It's like stretching a muscle that's been shortened for years. The first few days it protests, then it releases. And once it fully releases, you realize how tight it had been all along without you ever knowing. But now I need to tell you about something that separates the men who see real, lasting results from the men who feel a brief improvement and then fall right back to where they started. Because even if you do this technique perfectly every single day, there are hidden daily habits that can erase every single benefit before they have a chance to consolidate. These are invisible saboteurs, and when I name them, you're going to recognize yourself in more than one of them. Here's something that can help you go even deeper. I created a complete resource called The Medical Guide to Avoiding the Mistakes That Damage Your Prostate After 60. Inside, I break down the 4 most common things men do thinking they're taking care of themselves, but that are actually quietly making things worse. Mistakes that don't produce symptoms until the damage is already done. The link is pinned in the comments below this video. Grab it now while it's available, because it directly extends everything you're learning here today. Now back to those saboteurs, because understanding them changes everything about how effective the technique becomes. The first one is obvious, but nobody says it with the kind of directness it deserves. Prolonged sitting. And I'm not talking about an hour at your desk. I'm talking about the reality for most American men. 8, 10, sometimes 12 hours per day seated, in the car, at the office, on the couch. What that level of sustained sitting does to the pelvic floor is essentially train it to stay contracted permanently. The muscles don't just tighten while you're seated. Over time, they stop releasing when you stand up. Contracted becomes the default, the new normal, the baseline state. And here's the detail that almost nobody notices. It's not just the time you spend sitting, it's how you sit. If your pelvis is tilted back, if you're slumped into a deep couch or a bucket seat, you're pressing directly against the perineum for hours at a time. You're essentially sitting on the exact point that controls blood flow and nerve function every single day, for years. And then wondering why things aren't working the way they should. The second saboteur is breathing. Most men over 50 are chest breathers. Short, shallow, fast. They've been breathing this way for so long, they don't even notice it. And that breathing pattern keeps the body in a low-level state of alert essentially all the time. The sympathetic nervous system stays slightly activated, the pelvic floor stays slightly contracted, the blood vessels stay slightly narrowed. Nothing dramatic, just constant, subtle, systemic tension. 2 minutes of intentional belly breathing per day, not automatic, but deliberate, with one hand on the abdomen, can genuinely shift this. The research on this is solid, but it has to be intentional. Your body won't do it automatically because it's been trained out of it. The third saboteur is posture, anterior pelvic tilt, where the pelvis tips forward and the lower back arches, puts constant pressure on the pelvic nerves. Rounded shoulders and a curved spine compress the abdominal cavity, crowding the internal organs and disrupting the circulation to the entire lower body. And the nerve signals that travel from the brain to the pelvic region pass through a spinal column that, if compressed and misaligned from years of poor posture, will distort those signals every single time. Posture isn't just about how you look, it's about the physical infrastructure your body uses to communicate with itself. The fourth saboteur is chronic low-grade stress, and I want to be precise here. I'm not talking about a stressful afternoon. I'm talking about stress that has become your resting state, your default, the baseline you've been operating from for so long that you don't even recognize it as stress anymore, you just think it's how you feel. Elevated cortisol over time doesn't just affect your mood or your sleep, it directly suppresses nitric oxide production. It reduces nerve sensitivity throughout the body. It keeps the sympathetic nervous system, your fight-or-flight system, running continuously in the background, and you cannot be in fight-or-flight mode and arousal mode simultaneously. These are physiologically opposing states. One shuts the other down automatically. If your default is stress, arousal never fully activates. It can't. The fifth saboteur is one that genuinely surprises most people. Hydration. When you're chronically slightly dehydrated, which most American men over 50 are without realizing it, your blood literally becomes more viscous, thicker, harder to move through narrow vessels, less efficient at carrying oxygen to the tissues that need it. And oxygen isn't optional for this system. Without adequate oxygen delivery to the erectile tissue, it can't fully expand. It loses firmness, sensitivity, and responsiveness. Then add alcohol to the equation, especially in the evening, especially spirits, and you compound every one of these problems simultaneously. Alcohol impairs circulation, it disrupts nerve signaling, it causes the kind of dehydration and inflammation that men tend to blame on aging, but that is actually almost entirely reversible. The good news, and I mean this as a real clinical statement, not as a motivational platitude, is that every one of these saboteurs is fully reversible. Not with dramatic overhaul, not with extreme commitment, with small, consistent, targeted habits that compound over time. Stand up and walk for 5 minutes every hour. Not a workout, just movement, enough to reset the pelvic floor and get blood moving again. Practice belly breathing for 2 or 3 minutes while you're driving, or right before you fall asleep. Press one hand against your stomach and make sure it rises when you inhale. Stretch your hip flexors for 60 seconds each day. These are the muscles on the front of your thighs that get shortened from sitting. When they tighten, they pull the pelvis out of alignment and compress everything downstream. Drink 1 extra glass of water between meals, not gallons, just 1 more than you're currently having. Reduce alcohol in the evening, especially hard liquor. Not forever, not perfectly, just enough to stop actively undermining your circulatory system every night. None of this is heroic. None of this requires a gym membership or a complete lifestyle rebuild. But each small action removes 1 layer of resistance from the system you're trying to restore. And when you stack those layers, the massage technique, the breathing, the posture, the movement, the hydration, the combined effect is dramatically greater than any one piece in isolation. Because here's what I want you to really hear. Your body is not broken. It has not failed you. It has not started a permanent decline that nothing can reverse. What it has done is adapt to the conditions you've been living in. And those adaptations have accumulated silently over decades until they became visible in the one area men care most about but talk about least. This is not a flaw in your design. It's a feedback system working exactly the way it was built to work. And that means it can be reset, not with medication alone, not with a single fix, but systematically, intelligently, by working with your body's own architecture instead of fighting against it. I have sat across from hundreds of men in my office over the years. Men who walked in convinced they were past the point of recovery. Men who had been carrying this for so long in silence that the shame had become part of their identity. And I have watched those same men, weeks later, walk back through that door different. Not because of anything miraculous, because they understood for the first time what was actually happening inside them. And they had a clear, real, practical path forward. Not because of expensive procedures, not because of long-term pharmaceutical dependency, because someone finally explained the mechanism clearly, because someone pointed to the specific, accessible point in their own body and said, "Here, this is where your signal is being blocked. This is how you unblock it. This is what you need to stop doing that's making it worse. And this is what you need to start doing that will make it better." Masculinity is not defined by seasons of difficulty. Every man goes through periods where the body feels slower, less responsive, less like itself. That doesn't mean you're weak. It means you're human. What matters is what you do next. Whether you carry the shame in silence or whether you choose to actually understand what's happening and take a concrete action about it. The men who get results are not the men with the best genetics or the youngest bodies. They're the men who stopped waiting for a prescription to solve something that a prescription was never built to solve, and started learning how their own body actually works. The gap between where you are right now and where you want to be is not as large as it feels. It's not a canyon, it's a block, a muscle block, a nerve block, a circulatory block, and blocks can be removed systematically, gradually, consistently. You now know exactly where this block is. You know exactly what's causing it. You know exactly how to apply the technique that begins to release it. You know the habits that are working against you, and you know the small shifts that can start working for you starting today. Consistency builds momentum. Momentum builds confidence. And confidence, that felt sense of reconnecting with your own body, of no longer feeling like a passenger in your own physical experience, that changes everything, not just in the bedroom, in how you carry yourself, in how you show up, in the baseline level of vitality you walk through your day with. Your body responds to the right signals at any age. I've seen it happen at 55, at 65, at 70. The timeline varies. The biology doesn't lie. When you give the body what it needs consistently and intelligently, it responds. That's not optimism. That's physiology. If this gave you something real today, subscribe. Because on this channel I cover what most doctors don't take the time to explain clearly. My goal is to give men over 50 the practical tools, the real science, and the confidence they need to reclaim energy, performance, and long-term health on their own terms. At the start of this video, I told you there was a point in your body, barely the size of a coin, that most men have never been taught to use. Now you know where it is, you know why it works, and you know exactly how to activate it correctly. The rest is up to you.